أجمعين. This is not a lecture style presentation. This is more interactive. And I'm not sure how we can have the sisters upstairs to be interacting with us. So if there's a connection between the sisters and one of the people here, maybe they can, pass the responses or messages. That's if there's a connection. So this way we will be having them also engaged with us. Now, the reason why I specifically, when the Sheikh asked me to present today, I immediately said to him, we need to talk about families' mental health. And what's behind it is what I deal with professionally and see from the need to be more aware about this concept. Now, that has been said, I want to make it more interactive and ask you, you heard this term a lot, right? You heard about mental health a lot. So when you hear this term or you heard that term, what does it mean to you? What does come to your mind? This is not like, as I said, this is not a lecture type style, so we want to make it more interactive. And the idea here is to get you to feel or understand, be more aware about what's about your own mental health, and to be also aware of what's mental health in general and how to be able to create it and maintain it in a positive way. So what does mental health mean? Any suggestions? Depression? Okay, that's mental illness. See, this is what I'm trying to get to. So mental health versus mental illness. So mental health is the optimum state of mind which influences your life in a positive way and help you to live a comfortable life. Now, the other side of the spectrum is mental illness, where mental illness is a status of the mind where you feel uncomfortable to be able to live an optimal life. And between the two spectrum, it's a continuum. We move from this side to this side, and it's we keep oscillating back and forth. Sometimes, however, we get stuck on one side, and that causes us to be having mental illness. So this is one of the things we need to be mindful about. But why it's important to be aware or to have a good mental state. Well, what's the application? What's the impact of mental health on our life? When someone having a good mental health, how does that person live? And when someone is having not so good mental health, how does that person live his life or her life? And how his life or his life is impacted? There's no judgment. Just speak your mind.
Well, it's motivation for the be positive.
Okay, to be motivated in your life, to live a positive life.
The negativity and that depress you and
exactly
disappoint you.
Mm-hmm. So when you are in a positive mental health, you are most likely to be engaged in an active lifestyle. Quite the opposite, when you're not having a good mental health, you're being prevented from fully being engaged in your life. And the way I deal with it, and this is what's Islamic perspective of mental health, the way I see it myself in my profession is that most of the time people with mental health illnesses or issues are most likely to be victims of shaitan. Because think of it this way, what's shaitan's main attempt in your life? To cripple you from being able to do your ibadat. To be able to engage in your ibadah, you need to have a positive mental health. You need to have the optimum enthusiasm to be able to engage. You're praying 5 times a day. To be able to do that, you're fasting Ramadan. You're going to be giving sadaqah. You're going to be going to Hajj. You're going to be fasting Ramadan. As we said, So these all requires from you to be able to engage in these activities. Quite the opposite. Most of the time, people who are not coming to Salah, most of the time people who are not fully engaged into, ibadat, most of the time, not in general, are associated with mental issues that prevent them from being able to unleash their potentials. Shaitan's main attempt is to, cripple you from being able to move forward in your life as a productive person. Now, and this is, by the way, one of the descriptions of depression. Someone was mentioning depression. Depression is a mental state, a negative mental state, in which by people would be most likely, feeling down, feeling unproductive, feels that their hands are tied and they're unable to, be themselves. Their productivity is very low. It could come to zero, and they become so negative. So this is why it's important to be mindful, first of all, about your mental health and maintain it in a positive way, so you're able to do more in your life, whether in your ibadah level or your interaction with people around you. So what does mental health affect? What are the things that impacted and affected with mental health? Yeah.
So initially, it's affect you mentally, like in terms of like the way you think about yourself. The second thing is like physically. For example, if you go to the gym and then you see yourself in the mirror, and then you see that like you're not living up to your like potential yourself. And the third thing is like spiritually. When you like enter in the masjid and then you see that so many people are, it's more about like you see the person who are more like spiritually inclined, and you see yourself like, where am I? Am I sinful? And that person, I look at it, he's so for example, he's more clean. I'm not that clean, but he's more like positive.
Yeah. So in other words, you say that mental health impacts your self-image.
Self-image.
Yes. What about relationships? Definitely.
Yes.
And mental health impacts directly your interaction with people surrounding you. That means your immediate surrounding, your family members. It impacts your interaction with the expanded circle around you with your friends, or if you have a friends in the first place, because some people don't have friends. Why they don't have friends? Because their mental health state is not in a positive way that would allow them to be able to create that connection with people around them. And also it impacts, if you're a student, impacts your ability to achieve academically in school. If you are a working individual, then it impacts your ability to be able to engage in your work environment and be a productive person. So you would see that mental health is impacting your spiritual life or religious life. It's impacting your family life. It's impacting your academic or your work life. And it is, an overall state which, if you do not have it in a positive way, then you're not enjoying your life fully. Now, our concept of life enjoyment, of course, is not to the concept of the Western perspective. We're going, extravaganda or going lavish. No, we're talking about being when you get to that state where you're living in the Jannah of the dunya, then you are, in the state of mind where your potentials are optimum. But now that has been mentioned. Now that it does impact the way we interact with people around us. Let's take just an example. What do you think some of the issues that our mental health, state can impact the relationship among the family members? Now we do have young people and we have parents. We have children and parents. So what do you think and how do you think this concept is impacting the relationship between children and parents, or even the parents among themselves? Because we're talking about the impact of this on the family. Any recommendation, any talks, any thoughts? Right. Sometimes people come to me, as a professional, and they say, okay, we need to talk to you because we're having an issue with our teen. What's going on? The teen is not active. They feel that their parents is unable to understand them. They feel that, their parents are asking them for too much. And sometimes the parents feel that the teen is not being himself or herself, and they are not fully engaged in the way they deem to be, to see it as a positive way. So, now, this by itself requires from the professional to look deep into what goes on into the teen's life. Are they having a healthy mental state? Are they dealing with issues like anxiety, social phobia? Are they dealing with things that are preventing them from being fully engaged with people around them? Is there a communication problem between the parents and the children? Are there issues between the two parents that impact the way the children are living their life? Because if you think of it this way, whatever happens in the family is like a system. What goes on impacts all the family members. If there's a positive, interactive relationship between the parents, then this spells on the children. Vice versa, when there's a negative interaction between the two parents, then it impacts directly the way that children are, seeing things in their life. And sometimes I do have, clients who come to me at an old age. They're adults, they're late 40s, 50s sometimes. And they're still, dealing with the issues that was not resolved adequately in their childhood. And so you can imagine how this is impacting, the livelihood or the relationship among the family members. Right. Now, that has been said. What is anxiety? What is depression? What is social phobia? These are all things you probably have heard of, right? What's OCD? Who knows what OCD stands for? You know it, right? It's just there. I'll give you a second. Yalla. Obsessive? Well, it's not clinical disorder. It's obsessive compulsive disorder, which one of the symptoms of that is being obsessive with cleanness. But other symptoms of that, by the way, being obsessive with your practice of ibadat. It impacts the way you see things around you. You will be focused only on a certain way of seeing things in life. Whether a child or a parent having OCD, it severely impacts all the family members. I've had couples who come to me suffering from OCD of the one side of the family, and then as a result of that, they could not tolerate it, and it could sometimes it get to the point where the divorce will be at the ultimate end for this relationship. Now, OCD also could be coming to you from the ibadah side, like what you said, being obsessed with cleanness. I know people who spend from 45 minutes to an hour plus in the washroom because they feel that they haven't done their tahara properly, or their wudu was not completed properly, or they take longer time during their ibadat because they feel that the Fatiha was not recited properly, and we know that recitation of the Fatiha is important in our ibadah. So that's these are type of issues that we could be facing or seeing when it comes to mental health. What about brother John?
OCD is congenital, or it can come anytime, any age factor of the person.
Well, then maybe we can talk a little bit what causes mental illnesses. What causes mental illnesses is something that I was saving that to talk about it a little bit later, but just to bring it briefly. Now, all of us, and this is what I try most of the time to explain to clients, that you shouldn't feel guilty and bad about having some mental health issues. Why? Because you as a human being have inherited genes from both sides of your parents. These genes were not chosen by you, so you did not have the selection process when you were born. And at the same time, these genes are impacted directly with the environment around you, whether it's the family, the extended surrounding, the outside the society, the culture, the religion, all the details. So the genes that you carry in your body are impacted with the environment around you, and whether they fade or they're being enforced would depend on how you, what environment you live in. So from that perspective, yes, there are factors that we have control on, and there are other factors that we don't have control on. There are different stages in which we go through in our life, primarily, adolescence, which is the most difficult stage in our life, in our lifespan. And in that lifespan, we're most likely to encounter mental health issues because of the simple fact that adolescents are, in the stage of their growth, they go through a lot of physical changes, huge physical stages. During adolescence years, the growth or physical growth of adolescents is in the highest. So they shoot up so high in a short time. Their cognitive ability also emerges in a very fast way, and their hormones inside the body also start to flowing in a faster pace. So there are so many changes physically happens in the adolescent body that emerges some challenges that could be manifested in certain mental health issues. The extreme of it is schizophrenia. It's not very common, but it is very, it happens once in a while that I do come across, situations where the adolescents are exhibiting schizophrenic, symptoms of psychosis or having, severe, mental health, problems that requires from them to be to have medical attention. Now, most of the time, these symptoms are associated with that stage in life. And if it's dealt with properly, then alhamdulillah, adolescents most of the time would be able to, inshallah, deal with it and move on. Right, my brother? Okay, just please stay with us, inshallah. So, yeah, you want to say something?
Yeah, I'm just finding a little bit of hard time connecting this to mental health.
Right.
And since you said anxiety and depression is mental illness, so could you give us like a brief description of what is mental health?
But what's mental health? And that's why I started asking what's mental health. Now, you're able to gauge your mental health through 6 issues. First of those is your resilience. Do you see yourself as a resilient person that is able to deal with challenges in your life? For instance, now what do we, when we hear about what's happening in Gaza, the first thing that comes to our mind is we're impressed with their resilience. Why? Because regardless of how difficult the circumstances they're living in a genocidal war, but yet they're still, exhibiting positive attitude. So the resilience is so high. So this is number one. If you see that you have resilience in your life, that means your mental health is in an optimum state. You're in a good shape. Another important issue is feeling in control of your life. Many of the people who come to me say it clearly, I don't feel I'm in charge of my life. I'm unable to control my life. I feel like a feather being swung, blown away by the wind from one side to the other side. So controlling your feelings is another gauge in which by you're able to see how positive your mental state is or not. Now, feeling confident, self-esteem, like the brother was saying. When you look into the mirror in the morning, do you see an image of a person who is, confident, who's, positive, who's feeling good about life, or you're seeing a person who's defeated from inside and don't have the strength or, the courage to go outside and deal with people around you? So this is another gauge that you look into as, to see how positive your mental health state is. Feeling good about yourself. Do you feel that you're like do you see yourself as a positive person, or you always have negative thought about yourself? You're feeling always, I'm worthless. I don't. Life is worth not living. Or do you see yourself as a person who's contributing, who's playing a role in life, in your life and the life of others around you? So this is number 4, that feeling good about yourself. And number 5 is managing and expressing your emotions. There are people who are having difficulty to express their emotions. They feel that they could be judged easily. They feel they could be criticized. Now, do you have the self-esteem and the confidence to be able to express yourself in a way that is making you feel good about sharing that with others around you? Or you feel like my feelings are not worth to be shared because I'm so vulnerable. If I share them, I will be criticized, and I could be that will cause embarrassment for me. Now, building and maintaining good relationships with people around you. Again, go back again to the scenario we're talking about. If the relationship between the two parents are not optimum, there is definitely a problem of mental health with either side or both sides that needs to be addressed. Are there issues between children and the parents? Indeed, if there is something, then there is possibility of mental health issues that needs to be addressed. If the relationship is optimum between the two sides and among the family members, then you're seeing a very positive mental health state. Does that make sense?
Yes. Yeah.
Alhamdulillah. So that has been said. It's a spectrum. It's a continuum. There's the positive side and there's the negative side. Now you need to gauge yourself by the 6 things we're talking about. If you feel that these 6 things in your life are in the optimum state, alhamdulillah, you're in an excellent healthy state. Now, chances are not so many people are in that stage or staying in that stage for long. However, we continue to move back and forth between the two side of the spectrum. And the most optimum state is staying in between. There will be moments when you feel a little down, but you bounce off again and you charge yourself and come back again to the positive, healthy state. Or there will be moments when you're thriving and being in the opposite, quite the opposite, or the optimum side of the spectrum. Like what we felt through the month of Ramadan. Remember? Throughout the month of Ramadan, we felt, subhanAllah, the optimum. We were engaged, we were happy, we were content, we were, our ibadat. And this would help us to talk about how the tools that help us to maintain a positive, healthy state. Right. Now, I wanted still to talk a little bit about some of the main issues that mental health issues that people are dealing with or struggling with in their life. We talked about depression, and we said depression is feeling down, feeling your hands are tied, feeling yourself, not being yourself, not being optimum in your productivity. If you're a student, you just don't feel like doing your homework. You don't feel like attending school. You don't feel like sitting with your family. You're always sitting by yourself. You wanted to just be yourself. You sleep too much or you sleep too little. Whether an adult or an adolescent or a child, and you feel that you're sad. Not sad for a day or two, or 1 hour or 2 hours or a day or two. We're talking about an extended period of time where you feel like weeks are elapsing and you're still in the same sad condition you have started with some time ago. If this is what you feel, then definitely there is a problem that you need to address and deal with. What about anxiety? What's anxiety or panic attack or social phobia?
Getting nervous.
These are heavy stuff, right? But okay, go ahead.
So, in terms of anxiety, it means example, you're very happy, and then at the moment, suddenly, it's so you remember something that can make you sad. Like it happens suddenly,
Yeah.
you're happy, and then you remember something, and then it makes you neutral.
Right, I'll give you a practical example. I was doing a class service this morning, and I always joke about it and try to make it fun and interactive. in certain circumstances, you feel your anxiety is high. This could be positive, by the way. It's not all the time negative. But when it becomes negative, when it cripples you from being able to live a normal life. Now, a couple are getting married, groom and bride. Of course, this is anxiety provoking. They're doing, one in a lifetime experience. So their anxiety is so high. So I was joking about them. I told them, looks like you're so calm today, so I will not provoke your anxiety. And I start, asking them some questions that make them a little, provoked. And then their anxiety was shooting so high that they blushed and they become, excited. So that's, a positive scenario where anxiety could be provoked. Now, the negative scenario where anxiety could be provoked is when, let's say, someone is driving, and then they come at they are driving on the road, and then eventually they made it from the normal road to the highway. Some people, when they get to the highway, then their anxiety becomes so high. You're driving on the road and you happen to go over a bridge, a high bridge, like the bridge on Burlington and Hamilton. Some people, they cannot do it. They avoid going into that. If they go over that bridge, their anxiety becomes so high and they will have a panic attacks. Panic attacks is a condition whereby you feel your heart is pumping so fast and you become so anxious, and most of the time you do not know how to deal with this situation. And you need an external help to be able to calm you down and be in control of yourselves. So panic attacks and anxiety are common things that would attack people as a result of a previous experience in their life that have caused them to be conditioned to behave in this way, in that particular scenario. Whether it is driving on the road, they had an accident early in their childhood, and they continue to remember that incident in a negative way. It could be that going to school causes anxiety for children. Why? Because they happen to go to school and then they have an altercation with one of the teachers or one of the students in school, and then they become conditioned to feel this anxiety or panic attack whenever the school is mentioned in front of them, or whenever they're taken to school, or whenever they drive, go by a school. So these are things that could be, coming to people and develop in people early, to people early in their life, and will be crippling them from being able to live an optimum life. Now, can you think of other issues that people could be having difficulties with? We talked about OCD. OCD, by the way, is the same thing. The obsessive compulsive disorder behavior. It is primarily a genetical issue, but it's amplified as a result of the environment. And when people become so compulsive into their interaction with people around them, whether it's a cleanness, whether it's a ibadah, or whether it's an interaction with people around them, and becomes to the point where it's unbearable. People cannot tolerate it. It becomes to the point where, as in the family settings, it could lead to divorce, and could lead to, the children run away from home. That's how, the extreme scenario could be, for situations like this. Right. Any other thoughts or any other issues that you have heard of, or you feel that, that are issues that could be, dealt with in life or being experienced in life?
Like social phobia, as you were.
Social phobia, yes.
Like when some people, when they're walking in the street, they feel like everyone is judging them. And
exactly, we're watching them.
Yeah.
Social phobia is very common among young population primarily, and among adolescents, because the self-image, the self-esteem, the lack of experience of interacting in social settings prevent them and cripple them from being fully able to engage with people around them. They always feel critical of themselves. They're unable to take the initiative and reach out and interact. Now, why is this negative or is critical in young people's life, and why it's not so healthy? Because think of it this way: when they go to school, one of the main things that they're expected to do in the classroom setting is to engage, and they're unable to do it because of their social phobia. They feel that they're judged easily. They could be evaluated wrongly. They're always critical of their own self-image. So having social phobia or a social anxiety, by the way, not necessarily phobia. Phobia is the extreme side, but social anxiety, which is very common among teens, is common, and it's also unhealthy because it cripples their ability from being able to achieve academically. Right, now, that has been said. Now, what do you think the optimum way or the best way to deal with this issue, with these issues that we're dealing with in our life? How are we able to avoid mental illnesses or mental issues, health issues, and how are we able to maintain healthy, positive lifestyle or mental health? Yeah.
Before we go to that, is this the cause of the mental issue that people are facing?
Yeah.
Is it the personality or is it medical?
Oh, that's a good point. Is it a personality issue or is it a mental issue? Or the treatment for it would be done in therapeutic settings or in medical settings? That's probably the best way to address it. Now, there is a correlation between the two sides. Studies have proven that mental illnesses or mental issues are treated as effectively with psychotherapy as it is with medication. So there will be times when people come to me and say, okay, well, my child is having this issues, he's having psychosis, he's talking to himself or herself, they're seeing things, there's illusionary things in their life. I said to them immediately, these are symptoms of schizophrenia. Schizophrenia is a mental disorder that requires the medical attention. So in this case, this is something that psychiatrist needs to deal with. If it is severe, then the person will be admitted to a mental health facility, and in the mental health facility, they will give him medications to help him stabilize the chemicals in his brain to be able to function effectively. However, after that stage of stabilizing the chemicals in the body and the mind, then there is a need to do the psychotherapy for ensuring that the person is able to deal with the cause roots of this issue. Most of the time it's genetical issues, but the stress plays a huge factor into this. And as I said again, it's very common, primarily among young population, from my observation in the community at least. It also affects adults. That's not it's not only age-related issue, but it's hugely it's more common among teens because of the fact that there's a lot of stress and anxiety in their life than other spectrum of the community. So going back again to your issues, there will be times when medications are needed, and I work in collaborations with the medical doctors. As a matter of fact, medical doctors refer people to me. I refer people to medical doctors because when my client comes to me, I say to them, listen, I think you need to start with your medications. I can't give you medications, and I don't believe in medications. That doesn't necessarily mean that medications are not effective. Yes, but we can start with medications and use medications in certain situations along with the therapy, which would have, inshallah, an optimum outcomes. And as I said, the studies have proven that psychotherapy or therapeutic settings and interventions are as effective as medications. But sometimes medications will be more effective and psychotherapy would not be possible in situations where the patient needs medical intervention to stabilize them to the point where they're able to benefit from psychotherapy. So this is a very common issue that among people in our community. They think that, a person is having psychosis, he's talking to himself, he's seeing images, then he's possessed with jinn. Now, I'm not disputing the fact that jinn possession is there, because this is mentioned in the Quran. We believe that jinn are created, and jinn has the ability كَلَّذِي تَخَبَّطُهُ الشَّيْطَانُ لِلْمَسِّ, as Allah mentioned in Surah Al-Baqarah. So, that mas shaitan is there. And we know that sihr is there because Allah mentioned that in the Quran. وَمَا كَفَرَ سُلَيْمَانُ وَلَكِنَّ الشَّيَاطِينَ كَفَرُوا يُعَلِّمُونَ النَّاسَ السِّحْرَ وَمَا أُنزِلَ عَلَى الْمَلَكَيْنِ بِبَابِلَ هَارُوتَ وَمَارُوتَ وَمَا يُعَلِّمُونَ أَحَدًا حَتَّى يَقُولَا إِنَّمَا نَحْنُ فِتْنَةٌ. So sihr is there, we don't deny it. Jinn is there, we don't deny it. But however, The way to deal with these issues and differentiate between mental illnesses and spiritual illnesses, it needs to be clear. Now, we ultimately believe that Quran is a healer. وَنَزِّلُ الْقُرْآنِ مَهُ شِفَاءٌ وَرَحْمَةٌ لِلْمُؤْمِنِينَ. So we don't have any doubt. I personally believe strongly that Quran could be healer for everything, even your medical illnesses. I can stand up in public and say it even in medical settings. This is my own beliefs. No one can take that away from me. And we firmly believe it. It's a Quran we recite. And we have stories to endorse it from the life of the Prophet ﷺ. But now, again, do we have someone like Umar al-Khattab who with his hand would recite the Fatiha on someone who's sick and Allah would heal that person? Up to my knowledge, we don't have something like that. Right, Brother Zahid? Let's be realistic. We don't have people Rabbaniyin who are, ultimately, their ultimate connection with the lives of Allah is so high. So we need to be realistic. So we need to deal with what we have in more practical perspective. So we deal with it the same way. We do medications that help people stabilize their condition, and we go along with that with the mental and spiritual support to help them, create a positive environment and maintain a healthy state of mind. So there is no disconnection or there is no contradiction between the bigger understanding of mental health and the real understanding of Quran as a healer or ruqya shar'iyya. I personally encourage my clients to all of those. I'm trained as a mindfulness cognitive-based therapist. So therapy, spirituality is the core of my treatment plan. And using Quran and using dua and connecting in salah and being mindful and submissive in your salah and your Quran recitation is as important as taking your medication if you happen to have any physical sickness. So this is something that we need to be aware of. So now that we're just something from one from one place to another, but this is addressing all the issues we need to be exploring, so we're able to finish inshallah on time. Now, by the way, do you think that Muslims don't have mental illness?
They do, actually. They're extreme, either the right or to the left.
Exactly.
I've seen Muslims that they come to a point they say the life is not worth it because Jannah is our life, and then we don't have to do anything else.
We'll just go to Jannah. That's it. So take a shortcut.
And they live the worldly life and dealing with things and all that.
So the stigma of mental health needs to be changed, and the notion that certain group or certain faith background don't have problem whether physically or mentally also is not true. I do have people at different stages, and I do deal with people of different cultural background, different faith background, because it's irrelevant of the faith, cultural, or age background of any person. So that we need to just clear it from the beginning that discrimination is not healthy, and at the same time mental health is real, and we need to be more aware of it. And this is part of the studies that I'm going around and raising awareness about it, so people become more aware of what's mental health and how are we able to create a positive mental health and how we're able to eliminate negative mental health. Now, the question comes here now after this is, how are we able to deal with mental illnesses, and how are we able to maintain healthy and positive mental state? What do you think?
Exercise, gym, and
Well, part of it is staying, eating healthy, exercising, and sleeping well. What else? Yeah.
Reading Quran.
Reading Quran, staying spiritually fit. Yeah.
Like positive thinking process.
Yes, positive thinking process, but that requires from you into how are you able to create it. I agree with you, but how is the big question mark.
Because a lot of people have a sickness, like they feel like you said that they read like the surah, then they thought they've done mistake. They read again, they read again, or they do something.
Mm-hmm.
They thought that maybe they have done wrong. So these things has some kind of sickness. So they have some kind of treatment, like thinking process should be changed.
Exactly. So what you're saying is that perceptions.
Yeah, perception should be
Perceptions. or what you're talking about is, you know, the cognitive therapy. Cognitive
Yeah,
therapy.
only the therapist can like teach him step by step how to think, like how to like the develop the self confidence.
Yeah, yeah. So cognitive therapy is one of the models of treatment in psychotherapy, in which we will come to explain it inshallah in more details. So, you know, any other thoughts or into how we can deal with this? You know, what are the ways to yes, go ahead.
Being aware of gratitude and like basically help you like paying attention to gratefulness.
Are you trying to say don't be afraid or don't feel that you need not to reach out for help? So reaching out for help is okay. Is that what you're trying to say? Kind of. Okay. Well, I think we can put this as a point: is that do not feel discouraged or feel stigma, feel awkward by reaching out for help, by talking about what you're dealing with in your life. Whether go ahead, please.
Salah.
Salah is also another major component. Now we need to incorporate all those in more, in a practical way to come up with a real model of how to deal with these issues. Now, step number one is to acknowledge that you do have issues in your life. That's a step number one. I gauged myself with the 6 things I was talking about. Resilience, feeling in control of yourself, confident, feeling good, managing and expressing your own emotions, building and maintaining good relationships with others around you. If you see things are not optimum, by the way, I said, it's a spectrum. You don't have to necessarily be in the negative side, the far side of that spectrum, nor you have to be in the very far positive side of that spectrum. You could be in between. There are people who come to me and say, we do not have measures to do in our life, but we want to improve our life quality. And this is also mentioned to us in the Quran. Allah said, وَنَفْسٍ وَمَا سَوَّاهَا فَأَلْهَمَهَا فُجُورَهَا وَتَقْوَاهَا قَدْ أَفْلَحَ مَنْ زَكَّاهَا وَقَدْ خَابَ مَنْ دَسَّاهَا. So tazkiyat al-nafs is an ongoing process, early in life all the way to the end of life, where you're always striving to maintain a positive healthy lifestyle and to maintain your positive attitude. So yeah, go ahead.
And also I think like weed and phase, those are like a part of the life. And sometimes not everything is in our hand. Sometimes the fate decide who you win, who you lose.
Definitely, yes. This is something also to keep in mind.
We have to be like
That will be dealt with through the cognitive therapy.
Yeah.
Through cognitive therapy, we deal with situations like this, where a person, are going through such challenges in their life that they have no control on. Now, this is also again done in cognitive therapy. So, number one stage is we need to first of all defeat the stigma that mental health is not for crazy people. It's not something that we're affected with, but rather it is something that anyone could be affected with easily. Any person could be affected with mental health. Even the Prophet ﷺ, Allah Azza wa Jalla spoke about him. فَلَعَلَّكَ بَاخِعٌ نَفْسَكَ عَلَى أَثَارِهِمْ وَالضُّحَى وَاللَّيْلِ إِذَا سَجَى مَا وَدَّعَكَ رَبُّكَ وَمَا قَلَى. The Prophet ﷺ had certain times when he felt the tightness in his chest as a result of the disappearance of the wahi, Jibreel. And he was also anxious for people not believing in him. So these state of feeling anxious, feeling uncomfortable are not to be only for certain people with quote unquote the crazy people. No, anyone can have these things. So acknowledging that and being aware of it is number one. Number two is to reach out. If you're a child, talk to your parents. Tell them, what, I feel the need to talk to you about something. Be open with them. They're not gonna judge you. They love you, they care about you, and they want the best for you in your life. So talk to them. If you feel that they're unable to understand what you talk about, then reach out for someone else in your surroundings who understands you. Like many of you in schools have social workers or counselors. Now, you just need to be careful because sometimes these counselors or social workers might not be culturally or religiously sensitive. But alhamdulillah, nowadays we're seeing diversity within our school settings, whereby you're seeing a Muslim counselor at least, or a staff who is Muslim in school, who would have at least some understanding to mental health, whereby you're able to reach out for them and talk to them, and they can direct and steer you in the right directions. I got a call, by the way, not too long ago, from one of the families who was referred to me by the principal of the school, who said to them, listen, your child might benefit some from psychotherapy, but Islamic psychotherapy, and he referred them to me. So that's this is very common. So this is how to deal with it. So you reach out for people you trust from your surrounding. If you're a parent, have the courage, the confidence, and the self-esteem to reach out for help. There's nothing to make you feel less of a person, a man or a woman, if you're reaching out for help. There's nothing wrong with that. So number four will be when you do your reach out for a professional, or your family doctor. By the way, family doctors are good at doing the assessment, and the family doctors will be telling you, you know what, I think you should be seeing a psychiatry. I should be referring you to a psychiatry. I think, they will tell you, your issues can be dealt with a psychotherapist. As I said, many family doctors make referrals to me through their patients, for their patients to me. So that's after that, the further stage. And then after that, when you meet with the therapist will do the assessment for you. We'll be trying to find out what is it that you're dealing with in your life, trying to pinpoint and categorize the issues you're dealing with in a more professional manner. And from there, set an action plan for your treatment. And the action plan of the treatment will be based on certain models of therapy. And the most common, and at least the one I practice and I feel it's very practical, is the cognitive-based, mindfulness cognitive-based therapy. This is basically based on cognitive understanding. Now, in a nutshell, our mind is similar to the computing machine, any computing machine. Now we have this machine here. This machine has an operating system, right? And it has the Windows, which is the interface. Now, our mind's capacity, 90% of it is unconscious, and only 10% is conscious. What does this mean? It means there are so many things computed in the back of our mind done without our awareness. Let me give you an example to explain what I'm talking about. Now, how many of you have a young, sibling at home? An infant, toddler, a toddler? How do they walk?
Huh?
How does your sibling, toddler sibling walk?
She's 3.
They take one step and they fall off. They swing, right? Yeah. So that's how we learn how to walk. The first thing we start crawling, and then we take the first step, we fall off, and then we manage to make the first step, second step. Eventually, as we move along, we become able to walk. Now, this able to walk did not come from vacuum. It was all computed in the back of our mind. There's a lot of computing process and building, codes in the back of our mind. Until we come to the point where we're able to walk safely, professionally, and without necessarily having to think about it. The same is to be said of other activities. Those who drive, when they first start driving, they would be holding the steering wheel like this. They were, if you're driving stick shift, you will go like this and looking downstairs where, looking for the speed paddle or, the brakes. And then eventually becomes a habit for you. You can talk and drive, you can sing and drive, and you could, even text and drive, don't do it at all. That's it, the Sheikh was saying that text and drive. But become so skillful. Now, how you're able to reach that? Because you build the experience. Now, the same is to be said with many of the activities we have in our life. This would save us so much headache. Imagine if you need to think every time you eat, or you talk, or you walk. This is going to be too much. You'll not be able to do anything in your life. So much of those activities are computed, are stored and programmed in the back of your mind, like an operating system. Now, like your phone or the computers, once in a while you receive a patch saying that there's an update for your software, right? What's this update? Fixing the bugs. So you do have bugs in your mind that needs to be fixed. And the way to fix them is by coming to someone like myself dive inside your mind, find out the errors, and try to fix them and restart your mind. Does that make sense? Right on. So that's what's called cognitive therapy. So we try to find out what are the patterns in your thinking that are not so healthy and try to adjust them and fix them by bringing them to your awareness, giving you a healthier way of thinking, and practice on how to do them from now on much healthier way. Or we need sometimes to add on to top of that mindfulness or spirituality. And this is what I use all the time in dealing with therapy. Spirituality is very important in the life of a human being in general, and more specifically in our life as Muslims. Because we pray 5 times a day, we're connected with Allah Azza wa Jal, we have Adhkar al-Sabah, Adhkar al-Masa, with every act and action we do in our life, there's a dua. So we're very connected in our spirituality. And to maintain a healthy spiritual life means necessarily or automatically will impact the health of your mind. And by the way, there is a correlation, I think this is what you were trying to allude to at the beginning. There's a correlation between our mental health state and our body health state. Many people, come to me because they have gone to their family doctor. They've, done all the necessary, tests that they can, think of, blood work, CT scan, CG, whatever, all those tests, but nothing is showing that they have a problem. So then the family doctor at the end told them, you know what, I think you should see a therapist. They come to me, and I have some examples to share, but for the sake of time, we will not be able to get to them. Most of the time, we're able to find that whatever symptoms they're dealing with, the fatigue, the fast heartbeat, some of the pain that they encounter in their life is not coming from organic or physical problems, but will be coming primarily from the patterns of thinking or bend emotional feelings that they have encountered early in their life and was not resolved properly. Whether it's a trauma of a death of a loved person, whether it is the trauma of going through certain sad experience or harsh experience, like what happens to people who go through war experience, whether it's in Gaza or in Afghanistan or Myanmar or Kashmir. And unfortunately, there are so many examples like that. Or here's a person having a car accident early in their life that caused a trauma for them. So with that, we incorporate, at least in my practice, I incorporate the model of therapy into the context of Islamic spirituality to introduce a much more effective, way of treatment. Alhamdulillah, the feedback I have been getting from people is very positive. As a matter of fact, many people come to me and they say, we specifically come to you because you do have the ability to deal with both sides. Because we went to the mainstream psychotherapy and we just felt that's not of a help for us. So we need something that someone who understands our cultural perspective, our spiritual perspective, our religious perspective, and incorporate that in the treatment plan. Alhamdulillah, it has been working so far so good. So that has been said that your religious practice, your spirituality goes a long way into the treatment process. As a matter of fact, there will be times when people are dealing with trauma or heavy stuff in their life. Sickness of a child, death of a loved one. There's no possible way, at least effective way, to deal with these issues except by connecting them with their faith and religion. Telling them that Allah Azza wa Jal tests those whom He loved the most. That Allah Azza wa Jal said to us, trying to bring things to the right perspective and help them to make sense of the nonsense in their life. With this, inshallah, I can see that the time is coming close to Salat al-Isha. Unless you have something you wanted to add before we conclude, yes, please go ahead.
So at what point that you have to make a decision for yourself or somebody else?
Yeah.
You need professional help.
Right now.
That's one thing. That's
Right now.
What,
It's as simple as that.
like they're making a decision about someone that.
Yeah.
What is it like?
Right. Let me tell you. Based on
give
the
one example of the patients that they are prepared to you for the causes.
Yeah.
So we can see.
Exactly. I say it right now because I do mean it. Because most of the time, people are in denial. I don't have a problem. No, it's okay. I don't have to go. No, this is not for me. It's for crazy people. Now, again, when you feel we're not feeling so well, you go to your family doctor. Family doctor simply says, "Sir, sure, no problem. Let's do a blood test for you." They do a blood test for you. They got the results back. They say everything's fine. Would you feel bad about it? You don't feel bad about it. They'd say, "Oh, there seems to be something that we need to further probe or investigate, and let's deal with that." So take it from that perspective. Reach out for professional help. If there's nothing wrong, alhamdulillah. Did you lose anything? Nothing. But if there is a problem, then to prevent it from further escalating and causing more damage socially to you, I think it's worth it to reach out as early as possible. There are people that said, they come to me and it's too late. Like I have OCD people who, basically, they just could not help to maintain their family. The family house is gone.
How much is this session?
That's a good question. Well, most of my work is covered by extended health insurance. So those who have extended health insurance would not have to worry about it. It's fully covered with them. However, with those who don't have extended health insurance, there are ways to work around it. Like either we could look into the possibility of using a sliding scale, or there are some organizations who can subsidize part of the cost. Because this is, as I said, it's becoming an important issue in our community, and almost many centers or many masajid are having this incorporated as part of the community service they offer to people of their community. So though it is it is a paid service, but it is becoming now, the awareness is becoming so high that most of organizations like Nasiha, for instance, Nasiha is as an organization that deals primarily with youth, and there's like a helpline, a hotline where you can call at any time or text, and they have counselors, and I'm on board with them with their work. So so there are around. Just Google online mental health or Muslim mental health, and you will come up with a long list of resources available for you that you're able to utilize. And I said again. If, like in the case of people who have extended health insurance, they're not paying anything. It's just like OHIP. It goes through the system. So I know that there's only 5 minutes left. Unless you have an urgent, pressing issue, or from the sisters upstairs, if they want to send us, any comments, we will shall conclude with. Yes, Sir Shahzad.
I want to talk about some educational and awareness point of view.
Yeah.
That, as you said rightly, if we are honest as the public, out of 6, maybe 2 or 3 factors everyone have.
Yeah.
And we are in denial. We never admit that.
Yeah.
We know that we have lack of confidence or social phobia, whatever, but we don't go. What's the reason? Because the people like you, we have rarely in our community, where we can trust, where we have confidence that I can speak, and this is me and brother Ayman, that's it.
Yes.
Because even the general psychotherapist, you have fear. If I go there, then stigma comes over there.
Exactly.
Then as soon as I will disclose to any third person out of my family, stigma is that, oh, this person is mental disorder. Not mental health. Mental health is a sophisticated term over here, but in our society, this is mental disorder that
you're right,
he is a
exactly.
bad person. And what happens then? If you go to family doctor, where he refer you? There are few fingertips who will refer to you as a psychotherapist, otherwise psychiatrist. Every family doctor will refer to you to the psychiatrist.
By the way,
and psychiatrist, I have a personally specialist friend, and I talked to him that even to accept the psychiatry, there is another stigma that when they give you one medicine, okay, you accept, this is my treatment, this is my doctor, he knows better, one day. After 2 months, another medicine. After 3 months, another medicine. 2, 3, 4, and these are for long life. That's the reason people do not go and do not disclose. So this we need to personal approach to family doctor, personal approach to Nasiya, personal approach to the society, and wherever is educational workshops or seminars, psychiatrists should not be there. psychiatrists always say, no, this is my patient. This is my personal.
Oh, by the way,
community.
it's for your information, Brother Zaid. If your family doctor is referred to a psychiatry, you're talking about 3 months at least waiting until you're able to see a psychiatry. So there's like a very, a few psychiatrists who are available, for treatment, and the process is too lengthy. So, but to summarize what you said, because we need to stop. You're saying that we need to defeat the stigma, number one. We need to raise awareness, number two, and we need to also, be aware that, in Brother Zaid's perspective, that maybe, when you are taking medications, when things become so severe in your treatment and in your mental health, and you need medications could have side effects. So to prevent from reaching that stage, deal with the preventative measures. One dirham of prevention is better than fortune spent in treatment. So in another word, let's take this as a serious issue to raise awareness among our members of the community and among our family members, so that we're able to save things from going further, escalated, much more, so that we're able to deal with them at safer stages, and deal with them and save them.
My concluding point was most of the people do not need psychiatric treatment. There are few certainly need psychiatric treatment, and they should accept that.
Yes.
But the most afraid because ultimately they get to the psychiatry.
I'm not attacking psychiatry.
There should be a distance. There should be a distance.
Psychiatry, when you have an appointment with psychiatry, the maximum time psychiatry will give you 5 to 10 minutes. And the safest and the easiest way for them to get rid of you is give you a prescription. Now, however, don't quote me wrong. Treatment or medication would be essential at certain stages. But at the same time, when there's a way to deal with your issues in a different way than treatment, then I think it's much more effective. Just like naturopath versus medical treatment or or chemical treatment, chemical medications. So with this, I think we need to stop. Just in case if anybody wants to visit my website for more information or my social media, I am at ifs.ca, AIFS.ca. That's Al-Iman Family Center.ca. جزاكم الله خير والسلام عليكم ورحمة الله وبركاته.